Welcome to the Medicare 101 presentation brought to you today by the Medicare Medicaid Assistance Program, MAP. MAP counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company and they are not licensed to sell insurance. In many states, MAP is called the SHIP program, also known as the state's health insurance program. We are comprised of unbiased counselors located all across Michigan and available for free health benefits counseling assistance. A MAP counselor can help understand new healthcare options, understand Medicare and Medicaid, compare or enroll in Medicare prescription drug coverage, review Medicare supplemental insurance needs, understand Medicare health plans, apply for Medicaid or a Medicare savings program, and identify and report Medicare and Medicaid fraud and scams. What is Medicare? Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, or those of any age with end-stage renal disease, also known as ESRD. It is administered through the Centers for Medicare and Medicaid Services, and enrollment process takes place through either the Social Security Administration for most people, or for railroad retirees, through the Railroad Retirement Board. If someone is already receiving Social Security benefits, for example, getting early retirement, they will be automatically enrolled in Medicare Part A and Part B without an additional application. They will receive an initial enrollment period package, which includes their Medicare card and other information. This will come about 3 months before their age of 65, or 3 months before their 25th month of disability benefits. Coverage begins with Medicare on the 25th month of disability benefits. If someone is not getting Social Security or Railroad Retirement Board benefits, for instance, because they are still working, they will need to sign up for Medicare Part A, even if they are eligible to get it premium-free. They should contact Social Security 3 months before turning age 65. If they worked for the railroad, they'll contact the Railroad Retirement Board to sign up. While Medicare is administered by the Centers for Medicare and Medicaid Services, the Social Security Administration is responsible for enrolling most people in Medicare. The Railroad Retirement Board is responsible for enrolling railroad retirees. To enroll with Social Security, you can visit their local office or call them at 1-800-772-1213 or online at socialsecurity.gov. If you retired from the railroads, you can enroll with the Retirement Board for Railroads by contacting the local Railroad Retirement Board office or calling 1-877-772-5772. Social Security advises people to apply for Medicare benefits 3 months before the age of 65. You do not have to be retired to get Medicare. The full retirement age for Social Security retirement benefits is now 66 for persons born between 1943 and 1954, and it will gradually increase to 67 for persons born in 1960 or later, but you can still receive full Medicare benefits at the age of 65. The initial enrollment period lasts 7 months. It begins 3 months before your 65th birthday. It includes the month you turn 65 and ends 3 months after you turn 65. Signing up during the first 3 months of your initial enrollment period to get your Part B coverage effective the month you turn 65. However, if your birthday is the first day of the month, your coverage will start the first day of the prior month. If you wait to sign up until the last 4 months of your initial enrollment period, your Part B start date will be delayed. The original Medicare card is red, white, and blue, and it's used when a beneficiary receives health care. The Medicare card shows the Medicare coverage, Part A for hospital coverage, and or Part B for the medical coverage, along with the dates in which those coverage start. This card does look different from prior, as the Medicare ID card no longer shows a Social Security number as the claim number. Now, the Medicare ID numbers are a unique combination of numbers and letters. If you are keeping the card, you are accepting Medicare Parts A and B. If you're choosing to delay your enrollment in Part B, follow the instructions on the back of the card and return the card. Medicare has 4 parts. Part A is hospital insurance, Part B is medical insurance, Part C is Medicare Advantage, which are plans like HMOs and PPOs, and Part D, which is Medicare prescription drug coverage. This is a view of the Your Medicare Choices from the Medicare and You Handbook. On the left-hand side, you'll see if you choose to take Original Medicare Part A and B and a Part D plan for drug coverage, then you may want to look at a supplemental plan or a Medigap policy to help offset any of the costs that you incur with Original Medicare. However, the right side shows if you take a Medicare Advantage plan, then you are putting your Medicare Part A and B together into one plan, either an HMO or a PPO. Generally, those plans do come with drug coverage. However, you can look at Medicare Advantage plans without drug coverage. You do not need a Medigap policy if you go the route of a Medicare Advantage plan. Within Original Medicare, you have Part A and Part B. Medicare Part A is your hospital insurance and helps pay for medically necessary services such as hospital inpatient care, skilled nursing facility care, home health care, hospice care, and blood that you may need as an inpatient. Medicare Part B covers a number of medically necessary services and supplies. Those would be doctor's visits, outpatient medical and surgical services, home health care services, durable medical equipment, preventative services like exams, clinical lab tests, screenings, and shots to help prevent, find, or manage a medical problem. Preventative services may find health problems early when the treatment will work best. This is a quick look at the Part A costs for 2020. Here you'll see that if you're hospitalized and admitted to the hospital, that the expectation for the beneficiary during their first 60 days of care in the hospital is that they will pay a total of $1,408. That is the Part A deductible. As the days in hospital inpatient increase from 61 to 90 days, the expectation is $352 a day. For days 91 to 150, the beneficiary is looking to pay $704 a day. Beyond 150 days, the beneficiary incurs all costs. In a skilled nursing facility, the first 20 days, the beneficiary is expected to pay nothing. Any additional days, up to 80, the beneficiary is responsible for $176 a day. Beyond 100 days, the beneficiary is expected to pay all costs. For home health care, you have up to 100 visits following a 3-day hospital stay as long as you meet Medicare conditions, and you'll pay nothing for those services except for the 20% of approved amount for durable medical equipment. If you're receiving hospice care and it is certified through a doctor, then the limited costs for the beneficiary are just for the outpatient drugs and inpatient respite care. Any blood that may be needed is unlimited if medically necessary, and the beneficiary is only responsible for the first 3 pints. Generally, there is no premium for beneficiaries who have worked more than 39 working credits. However, if you've only worked 30 to 39 working credits, there is a $252 monthly premium. If you've worked 30 or less credits, it's $458 for a monthly premium. This is a look at the Part B costs for 2020. These are general charges, and medical expenses like doctor's visits, physical therapy, speech therapy, those are all unlimited if medically necessary, and the beneficiary is responsible for 20% of the approved amount after meeting a 198 yearly deductible. Clinical laboratory services are unlimited if medically necessary, and the beneficiary pays nothing for those services. For home health care, they're unlimited as long as you meet Medicare conditions, and the beneficiary will pay nothing for those services except for the 20% of the approved amount for durable medical equipment. Any outpatient hospital treatment is considered to be unlimited if medically necessary, and the beneficiary is again only responsible for 20% of the billed amount after that 198 yearly deductible has been met. Blood is also considered to be unlimited if medically necessary, and the beneficiary only pays for the first 3 pints plus 20% of the approved amount for additional pints. The monthly premium is $144.60 per month for most individuals, and if a client is eligible for Medicaid or extra help, which we will discuss later, these charges can be reduced. All new to Medicare individuals get a Welcome to Medicare visit with their doctor. It's a great way to get up to date on important screenings and shots and to review their medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B. During the exam, the doctor will review the following: medical and social history, height, weight, body mass index, blood pressure, and a simple vision test, potential risk factors for depression, the review of functional ability and level of safety, which means an assessment of hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. Individuals will get advice to help them prevent disease, improve health, and stay well. They should also get a brief written plan, like a checklist, letting them know if any additional screenings or preventative services are needed. There's no cost if the doctor accepts Medicare assignment, and it is a great benefit for people to take advantage of. Medicare covers a yearly wellness visit. After you've had Part B for longer than 12 months, you can get an annual wellness visit to develop or update a prevention plan just for you. Medicare covers one annual wellness visit every 12 months. During the visit, your doctor will record your blood pressure, height, and weight measurements, review your potential risk factors for depression, review your functional ability and level of safety, which means an assessment on the following: hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. The doctor will give you advice and help you prevent disease, improve your health, and stay well. You will get a brief written plan, again like a checklist, letting you know which screenings and or other preventative services you will need over the next 5 to 10 years. You do not need to get the Welcome to Medicare visit before getting an annual wellness visit. If you choose to get the Welcome to Medicare visit, you will have to wait 12 months before you can get your annual wellness visit. You'll pay nothing for this exam if the doctor accepts assignment to Medicare. In addition to the Welcome to Medicare visit and yearly Medicare visits, Medicare covers a number of other preventative and wellness services. This slide details just a few of the wellness and preventative services covered by Medicare. Many other services are covered, such as bone mass measurement, glaucoma tests, diabetes self-management training, and obesity screening and counseling. Here's a look at the Medicare recommended adult vaccines, many of which Medicare covers at no cost to you. Be sure to consult with your doctor or pharmacist on what vaccines are recommended for you. This is a great resource that includes all the information on the previous slide that you can take home with you. It was developed by Lake Superior Quality Improvement Network and can be viewed online through their website. Medigap, also known as Medicare Supplement Insurance, are policies sold by private health insurance companies that cover the policyholder. They are meant to supplement original Medicare, so help pay for the gaps in original Medicare coverage like deductibles, coinsurance, and copayments. They pay for Medicare-covered services provided by any doctor, hospital, or provider that accepts Medicare. Medigap may cover certain things Medicare doesn't, depending on the Medigap plan. They must follow federal and state laws that protect people with Medicare. We could do an entire presentation on Medigap. The next slide shows what Medigap policies cover. If a beneficiary wants or needs a Medigap policy, please refer them to MAP. We can help. Basic benefits are covered by all Medigap plans. They include the following: Medicare Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up, Medicare Part B coinsurance or copayments, the first 3 pints of blood if needed for a transfusion, Part A hospice care coinsurance or copayments, and each Medigap plan covers different additional benefits. Plans C and F are no longer going to be sold after 2020 to beneficiaries that are new to Medicare on or after January 1 of 2020. While they do cover Part B excess charges, the price of these policies is likely to increase as the risk pool decreases. While technically Part D is optional, in most cases there are penalties to not getting it. Part D is the most complicated part of enrolling in Medicare. It involves researching plans, comparing prices, and more. MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. People with limited income and resources may be able to get extra help to pay for their Medicare drug plan. Different rules then for how to choose a plan. Part D is available for all people with Medicare. You can have just Part A, have just Part B, or both. You must live in the plan's service area. You can't live outside the U.S. You can't be incarcerated. You must enroll in the plan, in most cases by completing an application. And MAP counselors can help with this. Some people with limited income and resources are automatically enrolled. Medicare Part D is Medicare prescription drug coverage. The coverage is provided through Medicare prescription drug plans, Medicare Advantage plans, or other Medicare plans. Medicare Part D plans must cover a range of drugs in each category. You can join a Medicare prescription drug plan when you first become eligible for Medicare. An example, during your initial coverage election period, which begins 3 months immediately before your first entitlement to both Medicare Part A and B. After you enroll in a Medicare prescription drug plan, you must remain with that plan for the rest of the calendar year. You can also enroll in a Medicare Part D plan during the annual coordinated election period, also known as open enrollment, which is October 15th through December 7th each year. You can also change Medicare Part D plans during the annual coordinated election period. There are also times when one can disenroll or get a special enrollment period. All of this is covered in Medicare Renew, which is provided to all Medicare beneficiaries every year. We can also make copies available to you. Medicare Advantage is also called Part C. They are health plan options approved by Medicare, run by private insurance companies, and they're generally either an HMO or a PPO. Medicare pays amounts for each member's care. Advantage plans are another way to get Medicare coverage. If you join, you may have to use their network doctors or hospitals. Medicare Advantage plans Part C are health plan options that are approved by Medicare, that are offered by private companies, that sign a contract with Medicare. They are part of the Medicare program. Medicare pays a set amount of money to these private health plans for their members' health care, and in a Medicare Advantage plan, you may have to use their doctors and hospitals that belong to their network. You still have Medicare rights and protections. You still get all of your regular Medicare covered Part A and B services, and you may get additional benefits offered through the plan, including Medicare prescription drug coverage. Other extra benefits could include coverage for vision, hearing, or dental care, and/or health and wellness programs. Benefits and cost sharing may be different than in original Medicare, but in all plans, you usually pay deductibles, copayments, and coinsurance that vary by plan. You can join a Medicare Advantage plan when you first become eligible for Medicare during your initial coverage election period, which begins 3 months immediately before your first entitlement to both Medicare Part A and B, or during the annual election period, also known as open enrollment, and in certain situations that provide you a special enrollment period. You can only join one Medicare Advantage plan at a time, and enrollment in a plan is generally for a calendar year. You can switch to another Medicare Advantage plan or to Original Medicare during the annual election period from October 15th through December 7th. If you belong to an MA plan, you can switch to Original Medicare from January 1 through February 14th. If you go back to Original Medicare during this time, coverage under Original Medicare will take effect on the first day of the calendar month following the date on which the election or change was made. There are programs available to help people with limited income and resources pay for their Medicare costs. These include Medicaid, Extra Help, and the Medicare Savings Programs. If you think you might qualify or need help, call MAP and we will set up a private appointment with you. MAP can assist beneficiaries if they feel they are victims of fraud or abuse. This can include common schemes affecting seniors, being billed for services you never got or equipment that you never received or was returned, if someone uses your Medicare or Medicaid ID card for services, or if a company uses false information to mislead you into joining a Medicare plan. Some information quickly on the new Medicare cards. All Medicare beneficiaries should have received their new cards if they had Medicare prior to these card changes. Medicare numbers will not be a Social Security number anymore. Instead, they are a unique 11-digit alphanumeric number. Benefits for Medicare stay the same, and nobody has to do anything to get their new card. MAP is here to help. If you want to speak with a counselor about your specific situation, just give us a call. Our service is confidential and unbiased. We can counsel over the phone or in person, and no question is too trivial. We often deal with very complicated questions as well. More information and help is available. The Medicare New Handbook is mailed to each household with Medicare yearly in the fall. It includes the Part C and Part D plans in your area. Other publications are available on Medicare.gov, and the Medicare helpline is open 24 hours a day, including weekends. Just call 1-800-MEDICARE. That's 1-800-633-4227. Or contact MAP at 1-800-803-7174. That's 1-800-803-7174.